Welcome to this video on the pharmacology of antidepressants and anxiolytics, focusing on adverse effects, critical interactions, and safety profiles. Abrupt discontinuation of SSRIs and SNRIs can cause discontinuation syndrome, a cluster of symptoms known as finish. High-risk agents like venlafaxine and paroxetine require very slow tapering. Fluoxetine is low risk due to its long half-life active metabolite. Tricyclic antidepressants, or TCAs, have several receptor-mediated side effects. Muscarinic blockade causes anticholinergic effects like dry mouth and urinary retention. Histamine H1 blockade leads to sedation and weight gain. Alpha-1 adrenergic blockade can cause orthostatic hypotension and falls risk. SSRI and SNRI specific risks include GI upset, sexual dysfunction, and weight gain. SSRIs have an antiplatelet effect, requiring caution with anticoagulants. Venlafaxine, an SNRI, can cause dose-dependent hypertension and requires blood pressure monitoring. TCA cardiac toxicity is significant due to their quinidine-like effects, blocking fast sodium channels. This can cause QRS widening and fatal ventricular arrhythmias. TCAs are critically avoided in patients with suicidal ideation or pre-existing heart disease due to high overdose mortality. Bupropion is an NDRI with a stimulating profile, often used as an alternative to SSRIs because it lacks sexual dysfunction effects. However, it significantly lowers the seizure threshold and is absolutely contraindicated in seizure or eating disorders, or during abrupt alcohol or benzo withdrawal. Serotonin syndrome can be explained using the overflow analogy. SSRIs partially block the serotonin drain, while MAOIs completely seal it. Using both simultaneously causes a catastrophic overflow of serotonin. Serotonin syndrome is characterized by a triad of symptoms. Cognitive changes include confusion and agitation. Autonomic hyperactivity presents as hyperthermia and labile blood pressure. Somatic neuromuscular effects involve muscle rigidity, tremors, and clonus. Critical washout periods prevent dangerous interactions. Switching between a TCA, MAOI, or most SSRIs requires a 14-day washout. However, switching from fluoxetine to an MAOI requires 5 weeks due to its long half-life active metabolite. MAOI risks include hypertensive crisis. Inhibition of MAOA prevents the breakdown of dietary tyramine, found in foods like aged cheeses and cured meats. This causes a dangerous release of catecholamines, leading to a hypertensive crisis. Anxiolytics are categorized by acute versus chronic use. SSRIs/SNRIs and buspirone are for chronic use with a delayed onset. Benzodiazepines and beta blockers are used for acute symptoms due to their immediate onset of action. Benzodiazepine safety warnings include significant respiratory depression risk, especially when combined with alcohol or opioids. Chronic use leads to dependence, and abrupt cessation can cause seizures. Tapering is necessary, and long-term use is associated with cognitive impairment.